triggering is something that happens at like a brain level. Okay, so when a person experiences a trauma, there's a variety of ways that their brain basically makes sense of the trauma or helps them survive the traumatic incident. One of the ways that the brain can do that is to basically go offline or to become hypervigilant about what's happening. Sometimes people understand what's triggering to them and sometimes they don't. But the thing that happens is if you are truly triggered by something, you will have an involuntary brain response to it, where all of a sudden you might have this physiological response that comes out of nowhere because your brain has associated a non-trauma stimulus to the traumatic event and thus operates in the same protective way that it did when the trauma was happening as a way to mitigate the effect that it might have on you. A lot of people don't realize this. So when a person says like, oh, I'm just so triggered by this, they're not. Because also if a person is actually being triggered, oftentimes it's actually hard for them to articulate that they're being triggered. And they will often go into their trauma response instead of having the wherewithal to say, I'm being triggered right now. Some people have that ability once they work through therapy, but if you're a person who's experienced trauma and hasn't worked through therapy to understand your triggers and the way that you respond to them, you won't have that language.